All right, welcome to this episode of Inside Dental Facial Sleep Medicine. Today, I get to speak with Dr. Dania Tamimi. For those of you who don't know her, she is an oral maxillofacial radiologist trained at Harvard Dental School. She also will be speaking at our annual conference in Baltimore coming up on June 12th and 13th. Forgive me.
Yes.
Yeah, it's coming up soon. So, and also we'll link this in the notes as well. But Dr. Tamimi just gave a really great TED talk titled "Who's Afraid of the Big Bad X-Ray?" Is that right? Did I say it correctly? Yeah.
Yep.
So that is a great clip that everyone should view. Parents, providers, anyone who sees patients or talks about radiation and imaging in our offices. So what I really appreciated, Dr. Tamimi, about that episode was you used the phrase oral physician quite a bit. And in your role as a radiologist and kind of where dentistry is moving into, can you speak a little bit into how we're seeing this merge of medicine, dentistry with these advanced images?
Absolutely. Well, first of all, thank you for having me on the program, on your podcast. It always astounds me how people think of dentists and teeth as dissociated from the rest of medicine, the rest of the body, right? It almost seems like it's like a piece of equipment that exists outside of the body, with its own set of rules, its own set of training, its own set of insurance and all that stuff. And also public perception of what a dentist is versus what a doctor is. And people don't realize, or maybe it's just not in their consciousness that, the teeth are the beginning of your digestive tract, right? Put it together with the aerodigestive tract if you're going to talk about the maxillofacial complex, and the ability for you to breathe and to chew and to speak and to do all these facial expressions that require you to move your mandible. I mean, all that is connected to, your teeth, your TMJ, your airway, and all that stuff. So to think of the body as a disjointed set of structures really doesn't serve the purpose of, complete healthcare, right? We do need to start to look at people more comprehensively. And I think that dentists are partly to blame for this misconception because they kind of market themselves as, tooth doctors, right? So nice smiles, estheticians, bright white smiles, nice smiles, teeth in a day, convenience. There's also the point of convenience. Like I'm going to give you the service and I'm going to give it to you quicker than the person down the street, and also the fact that insurance doesn't cover a lot of the procedures that actually have to do with the complete human in mind, right? So it's very quite limited to anyone here in clinical practice knows this, trying to get insurance to reimburse you for anything is hard, let alone things that have to do with this general care, whether it's acquiring a cone beam CT to look at the three-dimensional structures, even getting a report, having someone who's trained, who is specialized to look at the scans, all that isn't covered by insurance unless you go through some loopholes, right? I think that we have a long way to go to start to help people understand really the role of dentists in general health. It's an uphill battle, as we all know.
Yeah.
And I'm glad to see that more and more people's eyes are being open to this. My eyes are open. And I think a big part of that is how cone beam CT enabled us to see how all these structures are related to one another. That was a big mover. I don't want to call it a metamorphosis, but it really has been from the caterpillar to the beautiful butterfly kind of thing, of just how important we are for general health as dentists.
Yeah, that metamorphosis or evolution of dentistry and medical imaging and whatnot. I would love to hear your perspective as far as now that you have access and what you can see from CBCT, going back to images we relied on previously. As a radiologist, how do you feel when you're making a diagnosis or when you're looking at an image, how to tell your story now that, oh, I don't have this in 3D and now I'm looking at it in a different view? What's your perspective on that?
You mean when I get a two-dimensional image to evaluate?
Correct.
I feel frustrated
Yeah.
because all the stuff in the craniofacial complex is three-dimensional, right? It's not two-dimensional. There are multiple facets to each and every piece of us, specifically in the craniofacial complex, very appropriately named complex, right? Because if you were to acquire a two-dimensional image of the head, which has all these structures, all these bones, all these ins and outs of the sutures, the joints, the teeth, all the surfaces of the teeth, all aligned in different dimensions, not all in the Cartesian planes, right? How are you going to see all that if you make a person flat Stanley, right? So, yeah, so three-dimensional imaging really has opened up our eyes to just how everything is related to one another.
Yeah. And so the challenge is in a busy clinical practice, we are ordering x-rays and it needs time to be read by a radiologist oftentimes. So what I find interesting in dentistry is we can read day of bite-wing x-rays. We know how to adequately view for caries or whatnot. But what throws a wrench into things sometimes is I gotta take that image and then send it off and then get it back and read it and then bring that patient back or whatnot. So we're moving into the frustration that medicine might kind of share with us is just the delay of diagnosis or the bringing the patient back. And the public might not understand the importance of that workflow. And also in a busy practice, it does kind of disrupt things a little bit.
Well, I mean, here's the thing. I mean, each and every one of us, and I'm talking about dentists in general, not just radiologists like oral maxillofacial radiologists, is responsible for the evaluation and interpretation of their cone beam CT images or whatever images are required. In the end, it's your job, right? So whether you're going to send it out to someone else or you're going to do it yourself, it is your responsibility ultimately. The care of this patient is your responsibility ultimately. And you, as a dentist who is not a radiologist, should take the time to learn some basic interpretation, basic evaluation of the craniofacial complex if you're using cone beam CT or if you're using plain foam, right? And many times what ends up happening is the dentist just zeroes in on the structure that they are interested in and they don't look at the full picture because there's something called the satisfaction of search error. The satisfaction of search error is like when you find something that you like, your brain just checks out. You're no longer looking with the same intent. It's a well-known error in radiology, in humanity in general, but specifically in radiology. And that's why you as a dentist, when you have your patient come to you and you're getting this cone beam CT, you need to take some time to look at it yourself or send it out. But there is a way to quickly look through things. So at least you tell the patient, okay, so for your specific issue, I found this. But there are other issues that I need to have interpreted and looked at adequately, and that's going to take
Mhm.
just a little bit more time. But at least you should have the know-how of going through the scan yourself for the structures that you're interested in for what the patient's chief complaint is or why they're there in the office, right?
Yeah, and I respect that response because I think when you teach and hearing your lectures and your podcast recently with Dr. DeLuke, you come at this topic with a great deal of empathy for the dentist and our perspective, but also for the patient. And you talk a lot about fear and how the unknown really prevents understanding of true risks and benefits and the value of a true diagnosis, too. So, in your TED talk, you talked about going to Chernobyl yourself. And I'm a pediatric dentist. I remember one mother came into my practice and she was worried about bite wings for her child. And she just hopped from room to room to room as if she were dodging rays and whatnot. And so there's this, yes, exactly. It was like she was taking hold and she was running behind barriers.
Yeah.
So tell us more about your experience after being at Chernobyl and kind of in adults or children.
Well, I mean, here's the thing. I mean, first of all, and I'm coming to you not just as a radiologist, but as a human being and as someone who has a little bit of training in the understanding of fear and trauma, and it's through my work in yoga therapy. And one thing that when you learn to appropriately interview your patients, okay, meaning that how can I say this? There is a very effective way of extracting information from a patient without seeming overbearing and without feeding them the information, making them like tell you what they think you want to hear, right? And that takes time and that takes compassion and care. All right. So it's important for all of us to take the time to interview our patients with that compassion and care in mind and understand that there are underlying reasons for fear. A very silly example is this, and I've never shared this with anyone, but here we are. The whole world will now know. My husband has been a scuba diver, but when we first met, I was not a scuba diver, right? And I loved the ocean and I loved marine life and all that stuff. And I loved sharks, but I didn't want to be in the water with one. But I love sharks, right? It's like learning about them and all that. So we were on a dive trip. I had just gotten certified, and it was my first boat dive, my first time to jump off a boat into the water. I've always done shore dives. You waddle in from the shore. And I was scared. What if I land on a shark? It's I know that it's silly, but when you're afraid, things are magnified in your head.
Sure.
That like
Yeah.
these improbabilities just become so magnified in your head, right? And I think now that I think of it, that's a very good analogy because the likelihood of a photon hitting an electron in this vastness, of what this human body is, it's quite rare. And all he had to do was talk me through it. Why are you afraid? Like I didn't know how to verbalize this, but when he said, "Why are you afraid? What are you afraid of?" And he's like, "Listen, this is like a desert. Like this ocean is a desert. What's the likelihood of you landing on a shark?" Anyway, so that was it. So that was a very important thing in terms of how I deal with people who are fearful. I realize that there is an emotional response here. And the emotional response requires calm and compassion on and understanding and listening on the part of the person who is not having that emotional response. And I think we all have to understand that's not just with x-ray imaging and all that. There are other things, other procedures that patients are fearful of, worried about certain things going wrong and all that. And it's important that even when things do go wrong, if you talk them through it prior and talk them through it during and after, the outcomes are going to be a lot better than if you were to just like not very, you know, how can I say, if you're detached from their
Right.
emotions, right? So anyway,
Yeah.
that's
And that's a beautiful reminder as far as, when you talk about being a physician and being a trusted source of information to a family that's obviously having a difficult time not understanding what the benefit is compared to the risk of taking an image. For us, it's every day. We do this every day and it's routine. Whereas, when you learn about trauma based care or histories of our patients, then things kind of make sense. And then being that trusted source for them is really helpful. So, just knowing your background and then in yoga and whatnot, I'm sure that is really helpful for you. What's difficult is I'm sure that would be so helpful if you were in the office and you were to talk to them too. And so we need to be reminded ourselves of, you know, transferring that message to our patients as we're advising for these images as well.
well, I'm only one call away. I'll be there to
Oh,
save the day.
hey, and you just kind of made that live on our so we be careful what you wish for. I know I'm
No, but I
remembering
mean, not just me. I mean, there are many radiologists out there that can easily put, like, if you need them, they would gladly, if you have a relationship with a
yeah, that's a
radiologist,
good
if you
reminder,
call
yeah.
them,
Mhm.
and ask for their help, ask them if they would offer that service to you and your patients if needed.
That's a great reminder, especially us in
Right.
private practice. We forget that, we are essentially in our own silos, unfortunately, when we move into private practice. But the model of being able to get that consult and collaborate, it's there. And I just demonstrated it right now when I just said, like, oh, I'm alone. I wish you were here. And you can be.
It can be. I mean, the world is a small place now. Look at this. Look, we're talking. I don't know where you are. I'm somewhere else. We're not in the same room, and here we are.
Yeah. Yeah.
So yeah, I think you just need to. In general, we tend to think those who are in private practice, we tend to think that we try to be in our little silos, doing everything on our own.
Hmm.
It's important to overstep that ego and realize that you can't do everything on your own and there are people who can help you. So taking the time to say, hey, I don't know everything, I can't deal with the situation without the help of XYZ, reaching out to that person, whoever that specialist is. I mean, it could be a third molar extraction, it could be whatever, just finding the specialist, finding the person that has a little bit more know-how in that specific procedure, radiology being one of them,
Right. Which is
and have them help you out.
Yeah, which is wonderful as you're speaking at the WDSS forum. We do have a lot of speakers from different backgrounds, and we're hoping to engage more medical providers and just kind of lean on that theme of collaboration. So I was happy to see you on the lineup as one of the speakers there in Baltimore.
Yeah.
As we wrap up, is there something that you think, some of the people who will listen to our podcast may not be able to make that conference. Is there something that you want to share leading up to it that kind of the theme you're focusing on that we could look into in case we can share some clips or give a sneak peek to the attendants who will be at the meeting?
Well, I mean, I'm what I'm going to be doing is I'm going to show a case, and the purpose of that is to help people see how it's done, so that any illusions of what how they think it should be done are dissipated. Because in the end, if nobody shows you how, if a specialist doesn't show you how the specialty procedure is done, you may think that you're doing it right. You may be getting a result that you think is accurate, is at a certain level, but in reality it isn't. And you don't know any better because, your eyes will only see what your mind knows.
Right.
And if you
Mhm.
don't have that bank of information, if you don't have that vocabulary, it's going to be really hard for you to pick up when you're not doing the job to the fullest extent. And that's why I'm going to be out there showing a case, showing how a radiologist would go through a case, a comprehensive case that has both a TMJ and an airway component to it, and of course teeth and all that stuff. But in the end, my purpose isn't to bring business to me. I have a lot more than enough. And there aren't enough radiologists out there to cover every single cone beam CT out there. Yeah, tell them I'm busy. I'm very busy. Okay. It's really to for all of us, for every dentist to at least have that rudimentary knowledge of how it's supposed to be done, right?
Mhm.
So that
Right.
and when you know, your eyes will see, right?
Thank you. Well, I
And
bet that'll be really
and
valuable.
and that's the topic of my next TED Talk, by the way, which I yeah, I delivered one 2 months ago. It's a different venue, different, yeah, so it's not out yet, but when it does come out, I'll send it to you.
Please share, and we'd be happy to spread the word as well as it's really
Mhm.
valuable information again for
Right.
providers and for the public as well. So these podcasts with the WDSS are really short and brief, and I think our future directions could be more robust of information that we can share. So I really appreciate you sneaking time in your busy schedule of May with your family demands and congratulations with your daughter and whatnot.
Thank you.
And we
Thank
really
you.
look forward to seeing you in Baltimore and hearing more from your lens.
All right. Looking forward to it.
Thank you so much.